Viewers, a warm welcome here in our studio in Sarakunda. This is Star TV News and I am Dado Cham. In the headlines tonight, MRC Gambia develops D3 printer device for medical staff in fight against COVID-19. Health Ministry to embark on voluntary testing, reveals Dr. Bitey during daily briefing. Gambia youths express disappointment over Vice President Aissatou Touré remarks. On the international scene, giant asteroid 1998 OR2 set to fly past Earth safely. More than 1 million infected in US. Venezuela appoints alleged drug trafficker as new oil minister. Those were the headlines, and now the news in details. The Medical Research Council, MRC, in partnership with Make 3D, a printing company, has developed a 3D printer medical device and a print personal protective equipment, commonly known as PPEs, for medical practitioners to help them fight against the coronavirus in the Gambia. Binta qualifies in this report.
In the wake of the COVID-19 pandemic, there are global shortages of personal protective equipment. PPE. Increased pressure on the global supply chain also means significant delay in accessing these valuable items. However, due to their partnership with Make 3D company, MRC was able to produce the printed PPE in their biomedical engineering laboratory. These partnerships enables them to produce essential, locally available materials while supporting local businesses. Dr. Babatunde Awukola, consultant, clinical and PhD fellow, said they are pretty determined in pushing the boundaries of medical research and medical care to help enhance better life for all. He noted that since the outbreak of the COVID-19 virus, the need for a 3D printed medical device has become a necessity.
Healthcare technology has been invaded by a lot of high-tech things all over the world. And one of such is three-dimensional printing. At the advent of the COVID-19 pandemic, the need for 3D printing has become more and more important.
Dr. Awukola noted that this is a very important tool in making sure that health workers who are responding to patients are always safe.
Against the background of global shortage of PPE, we recently innovated the printing, 3D printing of face shields. This is one of the tools that are important in ensuring that health workers at the front line responding to COVID-19 patients are not getting infected. With this COVID-19 response, some workflow in the clinical section of MRC the Gambia has to be changed. One of them is the fact that nebulizers are no more used for patients that have asthma. In place of it, we've decided to be using, for the safety of everyone, spacer devices alongside inhalers. This and more are the things that we've introduced. In addition to that, 80% of patients that have COVID-19 need no care. They can be taken care of at home. 15% of them would need oxygen and a little hospital stay, but there's a minority of 5% that actually would need a lot more than the regular medical care. For these patients, we also have an innovation that we are currently working on, which is our prototype CPAP, or continuous positive airway pressure device. What stands out for us is the fact that these things are made in a timely fashion with the usual delay between ordering and delivery taken out, and also in a customizable way, wherein if what we made is not working, we can go back to the printing lab, make another one, and use it for the patients or the people that need it.
Christopher Vandy, head of biometric engineering, said the partnership with Make 3D and the MRC have been really helpful. He said they have been able to identify critical parts that they usually order from abroad and are able to make them locally now. Silva Kak, director of Make 3D, stressed that when COVID-19 broke out, their partnership with MRC became stronger so that they can be able to develop this essential product. For Star TV News, I am Binta Koli.
During the daily briefing on the novel coronavirus by the Minister of Health on Tuesday, The Acting Director of Health Services, Dr. Mustafa Bitey, informed awaiting journalists that the Health Ministry will be embarking on a voluntary testing which is meant to detect the possibility of people carrying the virus unknowingly. The Acting Director of Health Services, Dr. Mustafa Bitey, set light on their next step plans in fighting the global pandemic.
Regarding our next steps, the Minister of Health will embark on the following: voluntary testing of all patients with respiratory symptoms at all health facilities, engage private pharmacists to report clients presenting with flu-like symptoms to the rapid response teams, sensitization of the public on the existence of burial teams in all health regions, fumigation of homes of newly discharged patients who have recovered from COVID-19, strengthen RRTs and contact tracing teams at all regions, expand isolation centers in all major health facilities and hospitals, deploy newly hired health personnel in their duty stations, enforcement of the letter and spirit of the restriction orders contained in the state of emergency declared, strengthen community surveillance in all regions, especially on designated border areas, continue with daily follow-ups of low-risk contacts and those discharged from quarantine, and encourage public reporting and self-reporting of suspected cases through the toll-free line 1025.
Dr. Bitey also talked about the country's current situation on the COVID-19, where he indicated that a good number of people who were under quarantine have been discharged.
And all tested negative for COVID-19. Of these 33 results, 32 are new tests conducted, and one is the result of a repeat test on the only active case now. 10 new persons, 8 Gambians, 1 Senegalese, and 1 Guinean taken into quarantine on account of traveling into the country from Senegal. Daily follow-up of 99 low-risk contacts still ongoing to ascertain manifestation of symptoms of COVID-19. The country currently has 89 persons under quarantine, 1 active case, and no probable case. A total of 456 tests were conducted and 10 are positive. 297 people completed quarantine, 645 contacts traced, and 310 people completed follow-ups.
Youth from different phases of life unanimously disagree with the Vice President Aissatou Touré's remark in which he said youths are not willing to work for their country. In an interview with Star TV on Monday, young people expressed their disappointment over the Vice President's remark, saying they are not nationalistic. Our colleague has in this report.
The Vice President drew scorn from young Gambians after she suggested that they're lazy. Dr. Aissatou Touré attacked young Gambians for refusing to work as laborers during the offloading of the COVID-19 emergency food aid at the Makati Square in Banjul. Lamin Fofana, a youth, rebukes her statement saying they're willing to work and love to work, but the government have not created that opportunity for them. He urges government to build more facilities for them to be able to work.
This is the reason why government youths are going back with all the risks, no matter how the risk is. That's why government youths are going the back way. If you go to the United States, many government are doing this offloading and offloading, but they cannot do in their own country.
Modula Mendine, a taxi man, also shows his disappointment on the Vice President's remark. According to him, Gambian youth are one of the most hardworking youths he has ever seen.
Alhamdulillah, yeah, so many youths actually used to sit and wait for jobs, good job, or some people will wait for traveling. But if they encourage or create more job opportunities for the youths, wallahi, so many youths will not just sit down there and say that they will be waiting for traveling or for waiting for better salary or something. So I think, on my own opinion, let's encourage encourage the youths by creating more job facilities for them.
Majority of these youths are always willing and ready to volunteer as well as work whenever their services are called upon. The absence of these services, such as employment, is one of the greatest reasons why most of them embark on illegal migrations, but not because they are not willing to work for the development of their beloved nation. They urge government to create more mediums of employment for them to be able to showcase their willingness and abilities to work, rather than calling them lazy. Reporting for Star TV News, I am Awokori.
And now the news beyond our borders. A light asteroid 1998 OR2 will fly past Earth on Wednesday. Astronomers say the asteroid, more than a mile, 1.6 kilometers wide, will not collide with our planet, but will get close enough for us to study it. Al Jazeera Andy Gloster reports from Florida, US.
When a small asteroid broke up over Siberia in 2013, the ensuing shockwave injured over 1,000 people and caused extensive damage. It was a reminder to space agencies across the world of the dangers asteroids can pose. The asteroid now heading our way has been classified as a potentially hazardous object, but scientists say 1998 OR2 is not a threat. It's travelling at 30,000 kilometres an hour and is at least 2 kilometres wide, but will pass by at a distance of 6 million kilometres.
We don't have to deal with it with fear, we have to deal with it with the science. So people should not be afraid of asteroids. People should be encouraged to assess the risk of these asteroids and to follow these asteroid research program, and most importantly, to maintain these asteroid research program in place.
Programs like NASA's Double Asteroid Redirection Test, or DART program, aim to tackle potential threats in the future. It's one of many programs around the world that not only track large asteroids, but have potential solutions to redirect them. The Arecibo Observatory in Puerto Rico is one of the facilities that tracks asteroids using sophisticated radar. Scientists here are already tracking the Apophis asteroid due to skirt the Earth in 2029. The head of planetary radar says their research is vital.
Without the planetary radar observations or very extensive optical observations, we would actually have to get prepared that it could hit the Earth in 2029. So now we know that we don't have to do that, and we can use those resources for something else.
This latest asteroid has been tracked for the past 2 decades, and for amateur and professional astronomers alike, it's being greeted with excitement and not fear. NASA scientists say they've tracked more than 90% of near-Earth objects that pose a global threat. Thankfully, 1998 OR2 isn't one of them, but it will be close enough to watch on a telescope like this. In terms of the visual universe, this is a close shave, but a celestial event that will be seen as a slow-moving star. Andy Gallagher, Al Jazeera, Miami, Florida.
More people have died due to the coronavirus pandemic on U.S. soil than all of the Americans killed during the Vietnam War. A tally by Johns Hopkins University shows more than 58,300 people have died and more than 1 million people have been infected, while more than 114,000 have recovered. Al Jazeera Gabriel Glozorda reports from New York.
A coordinated flyover by U.S. Air Force and Navy planes over New York City. A display of gratitude for healthcare workers and first responders here in what is the epicenter of the U.S. coronavirus crisis. A crisis that has put more than 20 million Americans out of work in only 1 month, and at one point had more than 300 million Americans under stay-at-home orders, transforming even the busiest cities like New York into ghost towns. The crisis has now hit a new milestone, over 1 million cases in the U.S. President Trump is accused of being slow to take COVID-19 seriously. In late January, when the first cases were in the U.S., he said it was under control and repeated similar sentiments for many weeks.
The risk to the American people remains very low.
Fast forward 2 months, and that forecast has proven to be spectacularly wrong. As the country and economy shut down, Trump and America as a whole were forced to face the stark reality.
There were numerous missed opportunities in the long term investing in public health. The budgets for public health have been significantly decreased over the years, and this whittling away of our public health system has really weakened our ability to respond in the more short term.
While most of those million confirmed cases in the U.S. have been relatively mild, many thousands more have not. More than 50,000 lives have been lost to COVID-19, and many thousands more expected. On Tuesday, Trump was asked about his earlier predictions in the light of the new milestone.
Well, it will go down to zero ultimately. And you have to understand, when it comes to cases, we do much more testing than anybody else. So we could go to some of these other countries, as an example, China. If you test, you're going to show many more cases.
The United States, and particularly New York, are a long way from being over this health crisis. And with persistent worries about large gatherings, the streets could remain mostly empty through the end of the year, leaving time for people to ponder questions, such as when will this be over? What will America be like when it is? And what went wrong? Gabriel Zondo, Al Jazeera, New York.
Venezuela's President Nicolas Maduro has appointed an alleged drug trafficker as the country's new oil minister. Tariq al-Assami was indicted in the United States last month over allegation he violated sanctions and received payments for facilitating drug shipments, charges he denied. The Trump administration has offered a reward of up to $10 million for information leading to his arrest. Meanwhile, the drop of oil prices has additional sanctions from the White House, making life harder for Venezuelans. Al Jazeera, Lucy Nami reports.
These cows are having a field day, eating vegetables that many ordinary Venezuelans can't. Farmers in La Grita are having to throw away their produce because there's no petrol to take it to market.
This is my bread and butter, the only thing I have to support my family.
President Nicolas Maduro blames U.S. economic sanctions for an acute petrol shortage that's causing havoc. Now he's removed the president of the state oil company, PDVSA, and replaced him with a key confidant, Tariq el-Aissami, who's been indicted by the U.S. Justice Department for alleged drug trafficking. This comes just days after the Trump administration gave Chevron Corp, the last major U.S. oil company operating in Venezuela, its marching orders.
The Treasury Department has announced a new, narrowly limited license for 7 months, which will allow companies that are operating there to begin their wind-down process.
The White House is hoping that more of the same sanctions, but under worsening circumstances, will finally convince the army to oust Maduro.
That will only happen when the military feels confident that they'll maintain their corporate power, their physical integrity, and their economic interests. And we're a long way from that, because, for example, the head of the military is on Washington's blacklist. It's an inconsistent strategy.
Meanwhile, an NGO that tracks political prisoners reports that at least 70 people have been detained in the last 5 weeks since the nationwide COVID-19 lockdown was declared. That includes 11 active and retired members of the National Guard involved in an alleged foiled uprising last week. Opposition Deputy Juan Guanipa says Maduro is using the quarantine to further social control.
He manipulates absolutely everything to give the impression that everything is under control when the worst is still to come.
For now, there are no signs of a political solution that could ease economic sanctions and hardships. But with a crisis of such magnitude, even the unthinkable is possible. Lucia Newman, Al Jazeera.
And before we end the news, a recap of our main headlines. MRC Gambia develops a D3 printer device for medical staff in fight against COVID-19. Health Ministry to embark on voluntary testing, revealed Dr. Bitey during daily briefing. Gambian youths expressed disappointment over Vice President Asteroid Toure remarks. Giant asteroid 1998 OR2 set to fly past Earth safely. More than 1 million people infected in US. Venezuela appoints alleged drug trafficker as new oil minister. That's all for this edition of the news. Please enjoy the rest of our programs and join us for tomorrow's news. Thank you.